I'm officially declaring a national emergency.
Italy has now had nearly 28,000 cases, with more than 2,100 deaths. And as the toll surges across the continent, Europe is now the epicenter of the COVID-19 crisis.
More cases are now being reported every day than were reported in China at the highest of its epidemic.
And now Italy's health service, one of the best in the world, is overwhelmed.
Now we are starting to discharge many patients, and this is very good, but as soon as we discharge a patient, we receive another one.
New admissions seen in tents outside hospitals to stop the spread inside. Thousands now fighting for their lives and their dignity.
We are almost at the same level as an emergency ward,
says nurse Alberto Poinelli at this tent hospital in Brescia. He says the main issue is the fear in patients who test positive, having to calm them, reassure them, and give them a plan they can trust.
Tonight, America's hospitals and healthcare workers under siege. Emergency room Dr. James Pruden testing positive for coronavirus. The 70-year-old is now in isolation in Paterson, New Jersey. And tonight, at the Life Care Center in King County, Washington, 46 employees testing positive. In another nursing home in the same town where 15 people have died, a doctor in his 40s is infected. Over 43 people have died in King County alone. Hospitals around the country now reporting both a spike in incoming patients and a shortage of critical protective equipment, also crucial to protecting themselves. Hospitals scrambling to prepare for the onslaught, setting up tents outside emergency rooms. New York Governor Andrew Cuomo calling on President Trump to mobilize the military to build more hospitals.
You overwhelm the hospitals. You have people on gurneys in hallways. That is what is going to happen now if we do nothing.
Another critical matter, testing. People lining up in cars for drive-thrus. Vice President Pence repeatedly saying more tests will be available.
By the weekend, another 1 million tests will be shipped around the country. The expectation that at the end of next week, 4 million tests will be shipped.
But it's not as simple as just sending out the tests. The healthcare workers need to be in full protective gear. A number of states now saying they're concerned about a shortage of protective gear to keep clinicians safe.
This is something we are very concerned about.
Testing numbers are also lagging. New York has conducted roughly 7,000 since the outbreak. Public labs in North Carolina, however, have only done about 300. And in South Korea, where the number of cases have flattened, 275,000 tests have been conducted. They're now even creating phone booth-type sites. Donovan Mitchell is an NBA player with the Utah Jazz. He's in isolation after becoming infected, and his case highlighting the need for more testing.
I don't have any symptoms. That's the scariest part about this virus is that, you may seem fine, be fine, and you never know who you may be talking to, who they're going home to.
Even those who do get tested are having problems. Amanda Fulma-Chan says her husband Titu's first test got lost, and they then had to complain to their governor before getting a second test, which was positive.
We still don't have the original test results that were sent out from Thursday, which is absolutely mind-boggling to me. These tests have got to be prioritized based on severity and acuity of these cases. Something is very, very wrong. I understand that everyone's learning as they go with this, but people that are in critical condition need those test results, quickly. They don't have time to wait.
He's now
on his first trip to the epicenter of the coronavirus outbreak, Chinese President Xi Jinping went on what commentators called a victory lap, visiting members of the Communist Party and health workers on the front line. He congratulated the people of Wuhan for defeating what's now a global pandemic.
The places he went to were obviously very choreographed, thought through. Everything was stepped in a way so that everyone was on message, so that it matched also the signalling in the newspapers, TV, all the Chinese media. It's partly winning the battle, but partly it's also signalling to people within China who were the winners.
A mass lockdown across Hubei province came into effect at the end of January, as well as strict quarantine and travel restrictions across China. 60 million people were forced to stay at home, including 11 million from the city of Wuhan. The World Health Organization has praised Beijing's response, but not everyone appreciated the robust containment measures. With infection numbers falling, the hashtag #WhenWillHubei be unblocked was read more than 100 million times on China's social media platform Weibo. The shutdown may have worked, but some say that success could also come at a cost.
Hubei, the worst problem is over. And maybe nowadays, Hubei is the safest place in the world because we are locked down. Nobody can come in and we cannot go out. But I think a lot of people will lose their jobs.
Think what it's like to be a doctor or nurse in the epicenter of the epicenter.
Tutti i sistemi di protezione individuali, dispositivi di protezione individuale, quindi il camice, i calzari, la cuffia, i guanti che sono da cambiare rispetto a quelli che ha addosso, la mascherina chirurgica, gli occhiali protettivi.
Carla Maestrini and her colleagues have lost track of the hours they're working in the intensive care unit of Cremona Hospital. Coronavirus patients are placed on their fronts while being ventilated, so gravity helps the oxygen get into their bloodstream. That's the normal protocol for a patient with acute pneumonia. But it's not working, and the staff don't know why.
Purtroppo qua da noi non abbiamo ancora visto nessuno risvegliarsi. Noi abbiamo bisogno di togliere il tubo a qualcuno e di vedere che qualcuno sta meglio, perché altrimenti non riusciamo ad andare avanti. Abbiamo bisogno di qualcosa che ci faccia capire che quello che stiamo facendo serve.
But 107 patients have died of coronavirus in this hospital group, out of 845 admitted.
Tanti decessi. E questo ci fa morire perché pensiamo di non riuscire a fare quello che siamo qua per fare, curare la gente e farla star meglio. E in realtà noi la vediamo morire, questo ci fa morire anche noi.
Cremona Hospital has been handling coronavirus patients from the beginning. That's more than 3 weeks now. They've put up a triage tent outside.
Ho capito che noi siamo impotenti davanti a questa situazione. È vero, noi siamo operatori abituati ad avere pazienti gravi in fin di vita, ci crediamo molto, ma questo susseguirsi così repentino di pazienti in pericolo di vita non siamo abituati nemmeno noi. È dura per tutti.
They've turned the pulmonology department into a sub-intensive care unit with another 30 beds. These patients have a better chance.
Deve essere rumore. Come? Il rumore.
Sì, cos'è?
È l'ossigeno.
Another worry is that while the elderly are more vulnerable, young people are also getting the virus.
40 anni che faccio il medico e non ho mai visto una cosa del genere. Purtroppo c'è una mortalità significativa. Non colpisce purtroppo, ahimè, solo le persone anziane. Abbiamo avuto anche un 23enne.
Thanks to the care he received, the 23-year-old survived, a boost for medical staff under acute strain.
A casa ci vado qualche ora di sera dove muoio sul divano e sprofondo in un sonno che non è sonno perché mi sveglio ogni ora con gli incubi. Mi aspettano mio marito e mia figlia che mi parlano e io non li ascolto. Loro mi chiedono se li sto ascoltando, ma io non li sento. Ed è terribile.
Today, the Italian government said the upward trend of the epidemic was slowing. Finally, a glimmer of hope for the hard-pressed medical staff of Cremona.
There can be no funerals in Italy, only names in the paper, pages and pages of obituaries for those claimed by corona, the dead laid to rest unaccompanied, their mourning families, some of them millions still stuck at home. But Italy may have acted too late, and perhaps not strongly enough at first. South Korea was hit around the same time, but has recorded just 75 deaths. Europe holds its breath to avoid infection, today issuing a 30-day ban on all non-essential travel to the EU. The European effort, though, is not coordinated. But America's closest ally, Britain, slower than others, only today advising people to stay home.
We need people to start working from home where they possibly can.
World Health Organization advice is more direct.
Not quarantine alone, not social distancing alone, do it all.
Back in Italy, Easter services disrupted. The Pope's solo vigil offering up prayers on behalf of millions. And every night, tributes are laid down for their frontline heroes.
We lit up candles every night. We want to pay an invisible but strong homage to all the doctors and nurses that are constantly working to help us here.
Washington State today, U.S. researchers tested the first experimental coronavirus vaccine, starting off with a worldwide hunt for protection, even as the pandemic continues to grow. I want to bring in Dr. John Brownstein now, Chief Innovation Officer at Boston's Children's Hospital. Dr. Brownstein, thanks so much for joining us.
Of course.
So the group tested today has 4 healthy volunteers who will be monitored over a period of time. Can you explain what this process will look like and how those people will be tracked?
Right, so we're at the early phases of this vaccine trial, right? So phase 1, meaning small group of people are going to be evaluating for how they react, how well they do, if potentially there's some efficacy, also some early information about safety. But we have to remember, this is a really small trial that it will eventually lead to more participants, but we're still so early in evaluating this vaccine. It's incredibly exciting. Vaccines are a big backbone of public health, and we should be striving. But again, we're still many months out from having something that we can really deploy to the public.
It's still incredibly early. I hear you saying many months out, but if these tests prove to be successful, how soon could the country expect a rollout of the vaccine?
So the vaccine that we're looking at is an incredibly modern type of vaccine. It's based on RNA. It's not the traditional way of building a vaccine, so we're going as fast as humanly possible. But the problem is that we're still, with phase 2 and 3, we're still going to have to test the efficacy, but also the safety. It's so important that we get this vaccine right. And so that's going to lead us to probably a year to 18 months before we can really have this vaccine well past, especially the first wave of this epidemic as it's unfolding across the country.
And we know that states are now taking testing into their own hands. Is there a benefit to spreading out the resources, or should there just be one overarching test?
No, I mean, I think the reality is we need all hands on deck on testing. Of course, there's the commercial labs, there's hospitals. Many people are now deploying tests. We need to have a direct understanding of what's happening in communities across the country so that we can really deploy the resources.